Hello, everybody. So this is going to be the summary for dog massage. Really, I realized after the last series of videos, lighting wasn't the greatest. So I wanted a quick summary with just the shortcuts of what to do. And I wanted a better angle so you could really just see my positioning and where my hands were at to get everything done. So again, this is Raven. She's being spectacular. Reinforcing some of our dog behaviors to watch for: licking of lips, yawning. Those are indicators of some stress and or appeasement behavior. So be aware that those exist. Look that stuff up. It's always good to get educated on animal behavior before working with said animal. So safety first, all that good stuff. Now, the first thing we're going to really reinforce is just doing some joint movement and stretching. I am going to give you a really nice close-up of some dog butt. Ha. So with this, one good assessment strategy is to look at how, when they are relaxing, laying around and just being a lazy dog, how they tend to have their bodies oriented. Just like us, with humans, patterns that cause a lot of issues are sitting too much. So that means your hips are flexed, your knees are flexed, the muscles, so the hamstrings closest and lower to the knee for us tend to be tight. Same thing with them. So tight hamstrings, calves, tight hip flexors, all of that. Now, without having to go into the manual therapy piece of putting in some pressure on these muscles, maybe it's slightly better suited to somebody that's practiced and doing some kind of massage therapy, some massage therapists, PTs, what have you. If you're feeling uncomfortable and uncertain, then, practice caution and go get maybe find somebody that can help show you and teach you in real time, and then you'd have a bit more confidence in how to do this stuff. Some of the safer approaches are just moving the joints through ranges of motion that don't feel like there's any barrier. If you hear me stumbling there, I'm trying to find a way to express to not push a joint through any barrier of resistance. So there's something called soft joint end feel versus hard joint end feel. The biggest one we don't want to ever push a joint through is if we ever find a hard joint end feel, we don't push into that and certainly not through it. So any resistance should feel like it's related to muscle. And if the animal kind of suddenly, pushes really hard out of it, just let them do that. Just let them really, get comfortable again, start from scratch, start all over again. So let's say I was working and all of a sudden she just decided to bring her leg up like that. Then I just let it happen, give her some good rubs, and then go back and try it all over again. So with this, I'm going to reorient her just a little bit here. Always a good idea to get something that that they're comfortable laying on. Soft surface is always a good idea. So their favorite dog bed. My hand positioning for this, we're thinking hip and knee joint movement. They tend to be all flexed up like this. We want to take it out of that into what's called extension. This is a flexion movement, flexion of the hip, flexion of the knee, flexion of the ankle. Stifle, hock, I know. And this is extension. Extension of the hip, extension of the knee, extension of the ankle. We want to go to this position and hold it for a few seconds, even for a much longer time. I could just hang out there and hold it in this position for a long while. And that's a good thing. Return it to flexion and go back into extension. That'll be one thing that we're practicing. The other one's going to be playing with what's called a deduction. That's taking the leg, when they're laying like this, up and away from the ground. Versus down toward the ground would be a abduction. Those terms are more related to the midline of the body. So AB is up and away from the midline. AD is down toward the midline. So you add to the midline, you versus you AB away. So abduct, adduct. Then there's some rotational pieces. Doesn't have to be anything crazy there. Just moving back and forth. Usually in that case, all I'm going to really be doing is grabbing all of the upper thigh muscles and just moving them back and forth. Kind of thinking like this. I'm feeling the hamstrings and the quads and just kind of moving that back and forth, creating some shear. That's good for the muscle compartments because we want those muscles to be able to move effectively. Everything needs lubrication in order to slightly move and slide effectively. The analogy I use is WD-40, like with a hinge and a door. Our body secretes synovial fluid for inside of the joint capsule, but there's also hyaluronic acid that helps our tissues, layers of muscle and fascia or connective tissue, slip and slide so that things can shorten and lengthen nice and smooth. So that's what we're reinforcing by just doing these nice joint movement practices. We don't have to turn it into a crazy yoga stretch. But just taking these joints to where they seem to comfortably want to flex. Flexion, you can go pretty far, you'll see. You see, I just take it to what's nice and comfy. There's still plenty of give there. Should always be a springiness, like there's room left over. If I'm thinking a specific angle for where I want the leg to go when I take it into extension, I want, if I'm using her spine as a marker, I want a good 90-degree angle perpendicular to that to at least get the leg all the way down. The femur specifically, if I'm getting more specific, I want that perpendicular to the spine. That's pretty good and safe. If it feels, if you're confident, we can take that a little bit further over the course of time. Start with going at this nice 90-degree perpendicular angle. Do that several times. Flexion and into extension. You can't do this too much, by the way. A few times a day, before and after some activity and exercise. Never a bad thing. Then, after we've done that a few times, think of it like we've warmed up the tissue in the joint. Then I can take it a bit further. So, going from maybe a 90-degree angle in relation to the spine, I want to maybe get that closer to 100 to 120. And I can put my hand right on the thigh and use that as my gauge. So spine right here. My other arm, I can cross my hands over. That would have been 90 right there. Versus here, probably getting closer to 100, 110. This is a good angle in which I'm sitting, where I'm kind of right behind her butt. This just lets me just pull and use my body weight. Let's see. Now, tend to be, because I don't really want to take this, by the way, while the leg's like flat against the ground. I want to try to get it where the limb is able to freely move without dragging, hitting the other leg, dragging across the ground. Now, I want to feel like, however, the limb is in line with the ground. I don't want to do too much of this while I have her in the abduction. We don't want to put too much stress at the joint all at once. Things to think about when doing joint movement is do a movement that is what is called in one plane at a time, versus taking it and going on these big angles and crisscrosses. So the technical term would be in the sagittal plane is where our flexions and extensions happen. So I'm just going to try to keep it in this one plane, just forward toward her head, back toward the tail. Same thing, forward toward the head, back toward the tail. Not introducing any other angle or twist or rotation or anything. After we've done that, I can hold. The farthest I would maybe do this, I would get that 90 degree, hold it there, and then do just AB, just lift up. I don't need it to be too big. This movement does not have to be large. Just going to, I feel a little tiny bit of resistance. But see, I still have plenty of spring. She's still comfortable. Everything's good. Her breathing's good. Her head's down. I know she's at ease. See, I can just, and then I let it back down. Up. And hold maybe a little of this oscillation. By taking these joints into different shapes, I'm changing the shape of the joint capsule. And when we do that, and then I kind of just move stuff back and forth, my intention is to tell that the inside membrane of that joint capsule to produce more of that synovial fluid. The body's a very energy efficient thing. If we don't change the shape of that joint capsule, it does not produce the fluid. So the more static and still a creature is, the more stiff its joints literally become. So movement is key. It's like anything big, easy controllable variables we have with our animals' health, as well as our own, is movement, meaning some exercise, and diet. Healthy diet and movement goes a long way for all things. And as we get older, stuff gets harder. Movements become more difficult. We maybe have to be careful, and the velocity and the duration at which we do movement. So with her, I have to try to watch, and maybe with certain toys that I throw for her, she'll just really sprint after, launch after, really activates her, seemingly her predator-prey instinct. So I've had to watch that when I do put her in a situation to sprint and go fast, it's on soft, even terrain. Nice flat grass would be ideal. And then the duration of how long do we do our exercise. It has to be long enough. I mean, this is a shepherd. I need to tire out its brain, otherwise she goes a little bit crazy. But, maybe I don't need to be out there playing for 2-3 hours. Half hour to an hour, that's plenty. You see how I just keep this going? Flexion and extension are going to be our key ones. And then I go a little bit further. Come back into that flexion. Go out, lift up. This is all just really good stuff for the knee and the hip, more specifically the hip. And the reason why hips tend to have more issues is because they're what's called a ball and socket joint. They're able to move in every single direction. So more chances for stressors to occur there. The knee is just a hinge joint. It just flexes and extends. So same thing with the ankle here. So as I do this movement, I'm doing good stuff for the knee and the ankle as well, especially in this flexion extension. If I incorporate getting the whole leg to flex, the whole leg to extend, I'm creating benefits for all of this. So if there is some knee underlying issue, or be nice if we could prevent as much as possible, right? With her, the key thing is the hip arthritis. She has been responding just absolutely wonderful to this. So I know I'm on the right track. Her balance within the last couple of days, this is the third day only that I've been really focusing on doing this joint movement and some of the manual therapy, and along with some of the exercises. Exercise video will be forthcoming, but I really can't stress how effective just this is. Flex, extend, take it a little bit further. I can tell you I've already picked up at least an additional 10 degrees going into, it's actually hyperextension if I'm trying to be a super fancy know-it-all. Flexion, extension, hyperextension. Then still a deduction, a deduction. Do that forever. Now, the manual therapy side of things, where I'm actually going to try to do some muscle release work. To simplify it, I'm going to go on to what's called the anterior portion of the upper thigh. Anterior just means the front. I want to get a hold of the hip flexors and knee extensors. These include muscles like sartorius, tensor fasciae lata, the quadriceps group. So this is one of the most important ones. If I just get my hands like this, create a nice, claw with both of my hands, that broadens the contact point. Being real pinchy with your fingertips can be more ouchy and harder on your hands. So, using all my fingers as one big claw, all my fingers, one big claw, and pull all at once. That's very safe. I'm going to use my leg to prop her leg up so that when I pull, see how that's going to keep it in line with where I wanted it? If I keep it down here, it's going to be just dragging across the bed. So I'm going to prop her leg up with mine, get both my hands up there, pretty high. I want to be close to the hip. I don't have to be super, super high, but as close to the hip as is comfortable. And then I just lean back. When I feel like I'm putting some decent pressure into those muscles, she's kind of squirreling around. When putting pressure into tissues, we all kind of have a response. It's an underlying autonomic nervous system response, sometimes called the alarm phase, where it's just everything has to gauge whether or not the application, the stress on the tissue, is safe. So my pressure should stay very even and constant. I just hang out. I literally am just leaning back, not a whole lot of pressure into the muscle. Just think about, even for yourself, how much pressure would you want on your upper traps? Just enough, but not too much. I can see her face. She's got her eyes closed. She's just relaxing. But I feel like I'm pushing enough into the tissue to be kind of denting, distorting the shape of the muscle. I want the muscle to feel like it's at least getting dented and bent. That's the only way we're going to get the tone to shift, is if we actually distort the shape of that muscle. So right there for the hip flexors. Don't have to do this muscle release work too much. 2 or 3 releases on one area is the most you need. In my opinion, one application that lasts longer is more effective than multiple applications that are of shorter duration. So this works really good. Oh no, I got a little Labrador who's going to try to come in and distract us. Vader, go lay down. Lay down. Lay down. Good boy. You stay. You can tell how spoiled they are. They all love their massage. Vader, you stay. You stay. Good boy. Now, for the hamstrings, I have to be just a little bit more careful. Vader, no, stay. He's right here, really excited and happy. He always wants to get in on the pets or the massage. Doesn't matter what it is. Attention, he wants it more than anybody else. So the hamstrings are going to be a case where I am going to pinch a little bit. The mass of the hamstrings is substantial. You should feel like when you get a hold of it on the back side of the leg, she's got a lot of hair, so it's harder to see, but I should feel like there's a lot of squish. Like I can grab that whole hamstring group. It all feels like, meat, muscle, and that I could kind of move the whole chunk of muscle back and forth. So I'm going to get a hold of it, and I'm going to use both my hands to kind of flatten my fingers out and try to just sandwich those hamstrings all together at once. So that compression from one side and the other, it's a good distortion of the muscle. Easy on my hands. She can put her leg wherever is comfortable. It's a little bit easier for me if she keeps it a little bit into extension. So I'm starting close to the knee. If they want it to be more flexed like she's showing me, got my foot on display there. But so you see how I just hand underneath on what's called the medial side, and then on the outside, the lateral side, and then just squeeze. Incorporate maybe a little bit of feel like I'm pulling up and away to apply more pressure to the medial part of the hamstrings, and then I could push more down and apply more pressure on the lateral side. So lift up, push down, lift up, push down, and just work my way higher and higher. Squeeze, lift up, and push down. Lift up, push down. You should have the perception that you're grabbing a big chunk of muscle and bending it back and forth. So, and that in the end is all there really is to it. If I had the shortcuts to follow that are going to work, 99% of the time, that you really can't go wrong with, it's doing this joint movement piece. Just take it back and forth. If you don't feel comfortable doing the muscle release work, then hey, this is very sufficient. We have to try to, sometimes with especially joint related issues, the structure is now a little compromised, so it doesn't feel safe for the animal or for us when we start to have joint issues to stretch, because taking that joint to end range hurts and has the potential to create more damage. So the person or creature in question no longer takes these muscles and tissues and lengthens them. I had stated a little bit in one of the other videos that she used to stretch out a whole lot more. Get these hind legs behind her and really look for a hip flexor stretch. And she just doesn't do that as much. So I then become the one that does it. Hi, Vader. Say hello. Yes, yes, yes. Go lay down. Go lay down. He's a good boy. Yeah. So joint movement, hip flexors, hamstrings, and apply these concepts all the way down if you want. Work a little bit on these shin muscles and calf muscles. Do a little bit of all of it. Work everywhere. Upper limb. It's all really more similar than dissimilar. It's never a bad idea. Take these joints. Just make sure it's a comfortable range of motion, no major resistance that you're pushing through. I am not trying to take this just some kind of stretch. Although we were talking about stretching, I'm not trying to take this and just really pull and take it to full on end range. I just want this joint to be able to comfortably and smoothly transition from flexion to extension. And you can see, even from when we started, just how much smoother that is. And there's something to simply be said for that we want these muscles and the joint structure to be able to very effectively shorten and lengthen. That's our intention, that's our hope, and that's all there is to it. So, joint movement with a little bit of muscle release work, that's as much as you could possibly hope for. And it really does do a good job, especially for the hip and knee related issues that we'll see with our puppy friends. So I hope that this summary helps, and we'll see you guys on the next one. Oh God, Vader!